Good afternoon. Hi, everyone. I love all the conversation happening here. It's wonderful. So welcome to the Public Health Committee's JF meeting, Friday, March 28th. And we will get started. Today, we anticipate this to be the last JF meeting that we will be having. So hopefully that means people can enjoy a little breather over the weekend. But before we get started, I wanted to take time now. We often do this at the end of the meeting, but I'd like to take time now as we gather to just say a few thanks to the people who help and support us to do this work. And I'd like to start with thanking someone everyone knows quite well, Beverly Henry. And yes, so Beverly is someone you don't always see, but Beverly is the heart and soul of the Public Health Committee. I learned today or was reminded today that Beverly came here to the General Assembly in 1994, and she joined the Public Health Committee in 2000. This is her 24th session. And to say that her wisdom and strength and guidance is a gift to this committee would be a huge understatement. So you heard, I hope, Beverly, the applause and the gratitude and the thanks. We have an amazing committee team, Peter Kolakowski, our clerk, and Kathleen Panazza, the voice of the 3 minutes, who has such a wonderful, gentle way to make sure everybody knows their 3 minutes is up. We also have Dave Ratcliffe and David Kaplan, who support us behind the scenes, who are upstairs and downstairs. Big thanks to all of them. We also have a tremendous and non-ceasing, nonpartisan team. They work 24/7, literally, to help us to have these bills ready for hearing and all the way through the process. We have Eileen Lawler Parker and Nick Panzarella from LCO. Thank you both so much. And we have from OLR, James Orlando and Nicole Dubé, who give us the research and information we need. Thank you both. We are fortunate in our team and we meet together. When we screen, we meet together as chairs and rankings with our policy teams as well. And we want to thank those, and we'll have, of course, my co-chair and our ranking members will have a chance to speak as well. But I also wanted to make sure that we were thanking our teams from Senate Dems, Molly O'Connor, from House Dems, Chris Jackson, from House Republicans, Adam Johnson, and from Senate Republicans, Jared Pico. Our policy teams also are a big part of the work that we do. We also want to thank CTN, who's with us till all hours of the night and day. And we want to thank all of our staff support for everyone around this committee. Those who are our aides, the people who are our press and publicity. I see Adrian. And our interns. Many of us have interns who help us in this work as well, and they are a really vital part of this effort here in the committee. Finally, I want to thank every member of this committee for your unique and important contribution to the conversations that we have. We are so fortunate and privileged to be sitting here in this role, and I am just incredibly grateful for each and every one of you. I want to thank also every person who has taken the time to testify and be here in front of us to share their wisdom and perspective, as well as the advocates and the lobbyists who work with us to craft these bills. Being able to participate in democracy in this way is just an incredible blessing, and I can't express enough gratitude. If there's anyone I missed, please forgive me, but no, we are very grateful for you. And with that, I'm going to turn it over to my co-chair, Senator Anwar.
Thank you so much, Madam Co-Chair. I just wanted to add a few more names to the people we needed to thank. The name on the top is this representative called Representative Kristen McCarthy Vahey. She's a gift to this state, to the community she represents, and she's an individual who has helped me value the processes and also as a social worker to the core. Anytime there are things that are going in an imperfect manner, she would frame them and help us look at things in a manner where we see the glass that is half full. And then that's a gift, and that's something of a important quality to have in public health, where it's a very emotional committee because there are things that we are looking at. They have people at the end of each policy, and their lives, important lives at the end of each policy. And then these are not easy decisions. So I wanted to thank you, Madam Co-Chair, for your work. And I'm honored to learn from you every day when we work together, and admire your capacity and values. And I'm also wanted to thank our ranking members, Senator Summers. Thank you for the work you do, and you have multiple roles at this time with the Appropriations Committee as well. So we and Representative Nicole Clerides Dietra, thank you for all you do. Many of the times during this session, the four of us spend probably sometimes more time with each other than with our families at times. And we sometimes don't agree and disagree the way we do with our families. But at the end of the day, we do come together, and we value and respect each other. So I wanted to thank both of you for standing up for what you believe in passionately, and also commit yourself to trying to do the best for the larger good, while holding on to the values that are critical to you. So we wanted to thank you for everything that you both do as well. And I just wanted to clarify, this may be our last meeting, but I think we may have another meeting if my Senate Bill 7.5 comes together, but I'm working on that, but we'll see what happens. With that, back to you, Madam Co-Chair.
Thank you very much, Senator Anwar. Senator Summers, I will turn it over to you.
Yes, good afternoon, and I'm sorry I can't be there in person today. I wanted to thank everybody on this committee. Public Health is a committee that I'm honored to be a part of. This is now my 9th year, and there are issues and ranging from well water, as we'll see today, to obviously very specific health conditions. And I want to say that public health is not an easy committee. There's so much nuance to the things that we do, but we all come to it with our perspective. And I know that everybody on this committee has everyone's health and well-being as the forefront on this committee. And I think those are wonderful qualities of this committee. I want to thank the staff. You put up with a lot of back and forth, a lot of changes in the bills, and a lot of time spent together talking and discussing. I want to thank Beverly in particular. She is really the public health queen. I'm going to name her. She is just an amazing person that I'm not sure how this committee will ever function if she decides that she doesn't, that she actually wants to retire and she doesn't want to come in every day. She is just amazing, and she's probably hiding because she's very humble and shy, but we can't function without her. Our clerks are amazing. Our lawyers are amazing. Our OLR staff is amazing. It's just a great and wonderful committee to work on and with all of you. I'd like to thank my ranking member, Nicole. We go back and forth quite a bit, and I'm honored to be the Republican leader with her on this committee. And I also want to thank our chairs. They are always willing to listen. We don't always agree, but that's the great part, because when we don't agree, I think we come out with the best solutions at times. I want to thank Representative McCarthy Vahey, who is really a calming force within our committee. Sometimes things get very heated and debated. I want to thank Senator Anwar. I've nicknamed you now, you're my work husband, just so you know, because I see you more than I see my family. And there's a lot of back and forth, and I'm hoping at the end of this meeting, it was traditional at the end of our JF deadlines. We haven't done it because of COVID, et cetera, but we used to have a JF party. So I'm hoping that we can do that when this day is over, maybe sometime next week, where we bring the committee together. And I'm looking forward to seeing how these bills progress throughout the system and across the floor. And again, just thank you for everyone's time and commitment to one of the most important committees I think we have here in the legislature, Public Health.
Senator Summers, thank you so much. And I love the JF party idea. We'll get back to you guys for next week. Representative Claridis Detria.
Thank you, Madam Chair. I'm on cleanup today, but I'm not going to go through and thank everybody, but as you know, our support staff is so vitally important to this committee. So with Beverly, I need to say she's my fashion gal, and we always discuss what shoes or bags we have on any given day, and the work you do for this committee is always appreciated, and no one else does quite an amazing job as you do. Kathleen, our 3-minute gal, who now has her new her electric candle warmer because of me, because we don't want to use flames anywhere. So you're welcome to those fun conversations we have. I couldn't do any of this without my support staff, Adam Johnson, who is always there, good and bad, both sides on my shoulder, giving me all the information I need to make the most informed decision in this committee. Jared Pico, he does amazing work. Paul Mandel, our newest person who kind of got shoved into public health the last minute. the co-chairs, I want to thank you for the work you do. We all do this work coming in because we want to do what's best for our constituents and overall arching the state of Connecticut. We don't always agree on how to get there, but it's always a good conversation, sometimes heated, and we sometimes get loud, but at the end of the day, for the most part, we're always working together to have some sort of compromise, and I appreciate that always. I'd like to thank the best caucus in this building and these people to my right here and on Zoom. Couldn't do anything without you. You guys rock, and no one else is better than you. So thank you for all that you do. And then lastly, I have an intern this year, June, who's a Trinity intern, and she's always, yes, the Trinity interns are the best. June comes up and says, "Can I ask you a question? Why you voted that way?" It goes, "Of course you can." I said, "That's your job." I said, "We don't have to agree." So it's great to hear different sides from the younger generation. And then my legislative aide, Bobby, who keeps me on the straight and narrow and keeps me going to where I need to go always. So Bobby, I love you. Thank you for all you do. And let's get going on our last meeting. Thank you, everybody.
Thank you, Representative Clara DeStitria. I will close by saying also a tremendous thanks to my co-chair and our ranking members. I'm usually not as eloquent as Senator Anwar is, but it is an incredible privilege to work alongside him and to work alongside Senator Summers and Rep. Clara DeStitria. And you hear me talking here about us sticking with our policy decisions and our policy perspectives. And whatever side of the aisle we're on, we're all unique individuals with unique perspectives. But the thing that I value so much is the friendship and warmth among all four of us. And it is, as Senator Anwar said, like family. And family is, family. So very much, I learned so much from each of you. And Senator Anwar, I don't know how you do the juggle of your of your patient life and here at the Capitol, and he never stops moving. You guys all know that. But we are incredibly grateful, and I know the spirit of the three fellow leaders of this committee is to get rolling and get going. And with that, we will turn to bills to be considered for JF action. Our first item on the agenda is Senate Bill number 1508. This is an act concerning medical records. This is a JFS to the floor, LCO 6931. Is there a motion?
So moved.
Moved by Senator Anwar. and
Second,
by Senator Summers. Thank you. The bill that's before us today, it changes the fees related to the patient health records. It will vary based on who requests the records, the types of records, and the numbers of pages. It sets a cap up, it's up to $1,500 in total fees, and it sets prices for paper and electronic copies, for medical imaging, and for tissues and block slides. Beginning in January 1st of next year, those fees must be annually adjusted for inflation based on the Consumer Price Index. And it also requires the Department of Public Health to post the adjusted rates on the department's website. The JSF language adds the provisions for patient health records from providers. So the original bill was institutions, and the new bill also includes fees charged by providers and makes some technical changes. Is there discussion on the bill before us? Representative Clara DeStitria.
Thank you, Madam Chair. Just a few questions. Where did this change come from? Who wanted this increase?
I think that there's been discussion in this committee, and also this year, there are discussions in GAE and in the Judiciary Committee. So I think there's been a lot of back and forth conversation over the years from providers who are seeing some of the difficulty in providing records and wanting to have those costs reflected. And I think this is more reflective of the provider side. Certainly again, those other bills are from the attorney side. And I think one of the things that we've said is there will need to be conversation among all of us after this bill hopefully passes out of committee.
Thank you. And I know there was a working group that was done, and we had the recommendations from the working group. And I don't believe, if my memory serves me, that their recommendations were increasing the fees quite so steep. I think it's like 120% increase from what it is currently. And I think we might be the highest state in the country on these fees now. I don't know if you just give me some more information why we didn't take the recommendation of the working group.
So I think your point is well taken in terms of the difference in some of the fees. And I think there is, as I said, a compromise that can be reached after this. I think this is from one perspective in terms of what some of the costs are to actually provide those services, but your point is well taken.
Thank you, Madam Chair. And I know we've heard, I'm sure everybody's heard from either the trial attorneys, they want this, they don't want this, and the fees are too high. My perspective on this is, as if I was a trial attorney and I have to get these medical records, they're charging me whatever they're charging me. Now I'm taking that cost and I'm passing it down to my client. And their fees that happens all the time, but it's just another fee. And it seems excessive. We didn't go by the recommendations of the working group. In the scheme of things, people are going to say, oh, it's not that much, but it's still 120% increase. So I'm hoping that if this bill does make it out of committee, that we consider using the recommendations from the working group. Thank you, Madam Chair.
Thank you, Representative Paradis Tetra. Further Senator Summers.
Yes, thank you. I just wanted to clarify a couple things. I sat on that working group, and that working group was comprised mostly of trial attorneys. I think myself and one other person were not trial attorneys on that working group. And so I think the information that came out of that group, in my opinion, I'll say, was not really well-rounded. I'll put it that way. And I also will defer to Senator Anwar, but I do believe that we have not increased the rates for requiring or requesting paperwork or records in years. So if you look at how much time it takes if you're a private physician and there is a lawsuit that is pending and you've been requested to provide somebody's medical records, it's not easy any longer to go just make a copy of paper records because everything is electronic. And the way our Epic's the number one, electronic records keeper, you can't just screenshot the page. It takes you like 4 different screenshots to make up one copy of a medical record. They're not formatted, so they're able to be easily transmitted. So it can take hours and hours of someone's, clerical staff to be able to go through and pull the records. It's also not easy to sort. You have to go through thousands and thousands of records. So it is a huge undertaking for especially smaller doctors' offices. So I think this just provides an opportunity to get out of committee, to then come with maybe the bill that's coming out of other committees, to come together and figure out some kind of solution in between. So I just wanted to say that for the record, and I will be supporting this bill today.
Thank you, Senator Summers. Representative Reddington Hughes.
Thank you, Madam Chair. While I would agree that there is definitely a need to increase the fees, it certainly has been way too long. I think that the amount of the increase is going to most likely harm the people that have the least amount of money. So when you have a person who is involved in a lawsuit that is a personal injury lawsuit and they are not someone of money and they are going to have to be paying these attorney's fees that are going to be directly affected by what this is doing, they may not be able to pursue that. So I think that it may have some unintended consequences the way that it is written right now. Thank you, Madam Chair.
Thank you, Representative. Is there further discussion on the item? Oh, Senator Anwar, yes, I wanted to make sure everyone else, I'm just gonna maybe close this out.
Thank you so much. I wanted to align my comments with Senator Summers. Here's the little bit of a background. We talk about cost of healthcare around this building. Um, One of the reason for the cost of healthcare, not the only, but one of the reason is the malpractice insurance and the malpractice related cost. It's no secret we have a pretty high in our state of Connecticut, to the point that we do not have enough OBGYN clinicians staying in our state. That's an unfortunate reality because the cost is much less in other areas, and they choose to go to the state where they would be able to function in an appropriate manner for what they've been trained to do, and not have to have this very high malpractice insurance cost. What has happened is they're good actors and they're not so good actors, and there are literally organizations whose job is to do fishing expeditions to get all the data that they can, and then they'd use various means. Now they'll be using artificial intelligence to figure out if there is something that they can go after any clinician at any point. And that's one thing that's happening in the industry. The second thing that's happening is that with the electronic medical records, there's so much data that's being generated. The third thing that's happening is that people have a choice of what information they want to select. So you cannot just have a response that I want everything about that person. People select what they want, and then somebody has to look at the records and identify, redact whatever needs to be done based on that patient's rights and responsibilities or requests. And that's part of the responsibility that needs to be looked at. These are HIPAA, and this is required information, but protected information or protected health information. What happens is that if this information goes from the patient's records to a lawyer's office, what happens after that is not HIPAA protected anymore. From that lawyer's perspective, they would actually send it to various consultants and individuals. So that's where it is important that real issues are dealt with rather than the randomness of what's unfortunately been happening in some respects. While this bill is trying to look at making sure that we are not somewhat abusive in this process of what's happening in the health and malpractice world, we recognize and respect the fact that there are others in this building who feel otherwise. And that's fine. And that's why if we pass this bill out of the committee, we should be able to put our heads together and look at what is the best way to do it. For the committee that made the decision, the working group, it's the makeup told you what the results were going to be. And when you do not have a working group that is not having all the voices represented, you're going to get to the recommendations, and then those recommendations are something that are not realistic or sustainable. So I just leave it at that. So thank you, Madam Co-Chair.
Thank you, Senator Anwar. I guess I would say is each committee comes from a different perspective, and certainly after these bills pass, it's my hope and expectation and my plan to help coordinate a conversation, because we will have to share all those perspectives. Representative Carpino?
Thank you, Madam Chair. I agree that our malpractice rates are too high. I agree that contributes greatly to our ability to access high quality healthcare professionals, because there are many other jurisdictions that are far more friendly to them. I don't think the cost of medical records is going to solve our medical malpractice rates or our access issues. I do agree with the good chairman that when you have a working group that is not well balanced, that perhaps you don't get all of the perspectives, but I think that issue is far greater than this one working group. I would argue that there are a lot of working groups that are not particularly well balanced and don't have enough alternative views on them. So if anybody in this committee is going to start working on that project, I am happy to step forward and help recalibrate the number and the identity of the individuals who will be serving on our working groups throughout multiple committees. There are groups both for and against this bill. I'm not a member of any of them, but I do have some experience in accessing medical records. My no today is because I don't think this is the perfect solution for a problem that we have been working on for a long time. I know that there are many works in progress, and we're often asked to vote for bills so that they can get worked on further. And I will continue the conversation But I don't think this is gonna solve any of our problems, to be perfectly honest with you. As someone who's had to request medical records, is both a practitioner and as both a patient. And they have been both paper and electronic, and they have gone over multiple jurisdictions. The only other point I do want to clarify is if an attorney is going to provide patient's records to an expert, there are confidentiality provisions. So once those medical records are shared, they're not just freely out there in the open. So I do want members of the committee to understand that. I thank you for your indulgence, ma'am.
Thank you. Not an indulgence, certainly your right and privilege as a member of this committee. And I appreciate that because I think we do have we had in our various revisions bill, for example, where different aspects of the law, some related to HIPAA and others related to the judiciary, meet one another. And that may be not a formal working group, but it may be an off-session conversation. That's an example. And so here is another where those requirements for keeping records safe with HIPAA in the medical setting, but there are legal requirements in the judicial setting as well. Senator Summers.
Yes, thank you for the second time, Madam Chair. I just wanted to clarify one point. In medical malpractice, what I have seen is if you hire an attorney, you're not paying for anything out of your pocket until there is an award. And out of the award, the attorney takes, let's say, 30%. That would include the costs. So if there are costs associated with obtaining the medical records, that would be part of the settlement. They are not asking for those costs upfront in all of the medical malpractice cases that I have seen. And I just wanted to clarify that because I don't want people to think people that have had an injury, let's say that they're disabled and they're trying to file a lawsuit against a physician, that they would have to come up with the money out of pocket initially for that particular, those records to be sent. Thank you.
Thank you, Senator Summers. And though I am neither a lawyer nor a medical provider, my understanding is that generally speaking, what you are stating is the case, though I would suggest it's likely the terms of the contract or agreement entered in with the given attorney. But I do believe that the model that you've described is generally practice. Again, I say that with the disclaimer that I, as you all know, am not an attorney. Is there further discussion on this item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Just clarifying, is it an amendment or the bill?
it's on the bill.
Okay, Beverly's not laughing.
Madam Chair, I vote yes. Senator Arnold.
She's,
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton, Senator Marks, Senator McCory, Senator Summers,
Yes.
Representative Gladys Dietrich,
No.
Representative Burgess Givallo,
Yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Ma'am, do you see me in the room?
I didn't hear your vote, please.
No.
Thank you.
Sure.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes to the bill, no to the amendment.
Representative Gilchrist, Senator Gordon,
Yes.
Senator Hockedal, Representative Cavus DeGraw,
Gavros DeGraw votes yes.
Representative Kitt,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez, Representative Morin Bello,
Yes.
Representative Parker, Representative Paletto,
Yes to flag.
Senator Rahman,
Sarah Rahman votes yes.
Representative Reddington Hughes, Representative Ryan,
Representative Ryan votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Thank you, Madam Administrator. Oh, I think it was Representative Reddington Hughes recorded. She's here
No,
with
she
us.
wasn't.
No.
Thank you.
Thank you very much, Madam Administrator. The plan at the moment is to leave votes open until 4 o'clock today. With that, we'll move on to item number 2 on our agenda, Senate Bill number 1538, an act concerning emergency department boarding and crowding. This is a JFS to the floor, LCO 6922. May I have a motion? Moved by Senator Anwar, seconded by Representative Jenga. With many thanks to the working group and our medical providers and others who have been a part of this conversation. I'm sure the committee recalls that last year we did pass a bill and requiring the hospitals to analyze certain data from emergency departments, which they did report to the Public Health Committee. The bill this year requires them to also, in the future, report annually to the Department of Public Health and the Office of Health Strategy. In addition, the bill, as we heard testimony, requires the probate court administrator and the DSS commissioner to evaluate establishing an expedited process for appointing a conservator for hospital emergency department patients who lack the ability to consent to receive services. The S language simply adds the provisions on hospitals, the requirement to report to both DPH and OHS. As we heard in testimony with this bill, we will be having ongoing conversations. This will certainly be another work in progress. We intend to sit down with the members of that working group and take a look at both their work, the ongoing recommendations, how that fits into some of the other bills and conversations happening both here and in other committees, and see if we can continue to advance this work. I will say that you may have heard Dr. Moore recommend watching the pit when he testified. And if you have concerns about this issue and some of the other issues on today's agenda, I would say don't watch it. It's a very good drama, but it's very stressful and accurate. So I think it does provide quite a lively depiction, and it's a TV show, so I'm just teasing. Are there questions or comments on the bill before us? Discussion, Representative Morin Bello.
Thank you, Madam Chair. I just have one question. In any of the discussions for collecting data, have we looked at people brought in from other hospitals to our local emergency centers? Is any of that data being looked at or collected? I did hear from someone who works in an emergency department who said some of the crowding feels like it may be from hospitals from as far away as Maine bringing, having patients brought into Hartford hospitals.
Thank you, Representative Morin Bello. I will confess that this is an area that I don't have the specific answer to. I think this is, as I spoke actually with Dr. Moore just yesterday, Senator Anwar has spoken with him a number of times, and we are planning to sit down and dive a little bit deeper into both the work of the working group, but also the report that was issued. So I don't have an answer, but I appreciate you raising that here with the committee today, because I think it's something we want to make sure that we're paying attention to. Thank you, Representative. Senator Anwar and then Senator Gordon.
Thank you so much, Madam Co-Chair. Thank you for the question, Representative, because what we are going to see in the near future is, especially in Massachusetts, a number of hospitals that have closed down. And there is a challenge because of the primary care and preventive care is not as strong as it could be. And sometimes the illnesses get too significant that they need hospitalizations. And the hospital beds are not able to manage them in a local area because of throughput issues. And that's part of the problem. So this is, I say that ED boarding is a symptom of a lot of other things that are wrong at this time. And that's why the fact that if somebody goes to the emergency room and they have to be not in a comfortable place and not being closely monitored for days is something that should be unacceptable. And that's why we start with the bill like we did last time and then expand on this and continue on to try and identify the different parts that lead to that process. So this, unfortunately, till the healthcare systems improve and the system gets better, we will be having bills like this that we will continue to try and see how we can get more ground and get the people the best care at the best place at the right time. That's going to be the goal for everyone in our state. And that's, we're far from it right now. And that's why we have to pursue bills like this. And it's good to know that a lot of people in the community are asking for this too. So thank you, Madam Chair.
Thank you for that, Senator Anwar. Senator Gordon.
Thank you, Madam Chair. I'm glad to see us continuing to do something as best as we can with regards to emergency department boarding. I actually had to spend part of my night last night seeing patients boarding in an emergency room. That's just the reality we face. Regarding patients who transfer in, it is not uncommon that we actually have to transfer patients to other states. That's just the reality. Most of it is someone in an emergency room in another hospital and they get transferred inpatient. That just is a reality. I've transferred people from this state to other states, and from where I also practice in Massachusetts, I've had to transfer patients as far away as Pennsylvania. If we can find a bed at a hospital, mostly it's a tertiary care hospital, and transfer someone, then we take advantage of it. As Senator Anwar said, it's just a part of an overall problem that we face with lack of inpatient beds in general. But it does pose an issue because we can't stop, and we shouldn't stop someone transferring from another state if that's what is required for the medical care. But then we have to be mindful that, you know, less inpatient beds and more people in the emergency room. So this gets into the whole issue of what do we do with our hospitals, community hospitals, things like that. But that's just the reality of the way it is, and it's not uncommon at all that calls are made to many, many different states. And it does take time, but, you know, my experience has been the Connecticut hospitals will receive patients and they won't deny them. But unfortunately, that's just a reality of lack of beds in many places. And as Senator Anwar said, some hospitals closing or losing services. So I do support whatever we can do realistically to try to address emergency room boarding issues. And again, thank that working group. They have a very, very good report. And I hope people very much read through their well thought through recommendations. Thank you.
Thank you for your comments, Senator Gordon. Indeed, you are pointing out and reminding us that everything is connected and these things impact. Is there further discussion on the item? If not, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton, Senator Marks, Senator McCory, Senator Summers, Representative Clarice Detrier,
Yes.
Representative Burger Givallo,
Yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Rep. Dauphiné votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Senator Gordon votes yes.
Senator Huckadell, Representative Cavras DeGraw,
Gavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez,
Representative Martinez votes yes.
Representative Morin Bello,
Yes.
Representative Parker, Representative Paletto,
Yes.
Senator Rahman, Representative Reddington Hughes,
Yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Ryan,
Yes.
one more time, Representative Ryan.
Yes.
Thank you. Senator Slapp,
Senator Slapp votes yes.
are you in the room or on Zoom, sir?
I am in the room.
Thank you. Representative Steinberg,
Yes. And if you ask me again, I'll tell you the same.
Representative Zupkis.
Yes.
Thank you, Madam Chair.
Thank you, Beverly. We love to see you smile. Oh, goodness. Okay, moving on to item number 3. This is House Bill number 7247. This is an act concerning sewage disposal requirements and their impact on housing development, public health, and the environment. I will note specifically that our agenda says that this is a JF to the floor, but prior to the, or excuse me, subsequent to the creation of the agenda, this has been changed to a JFS, and this is LCO 6941. Members should have received that as substitute language last night in a separate email. And may I have a motion?
So moved.
Moved by Representative Kitt, seconded by Representative Biggins. The bill before us, the proposal, requires the Majority Leaders Housing Roundtable on Affordable Housing to convene a working group that they will convene, by the way, not this committee, to provide recommendations on regulatory requirements for sewage disposal, including nitrogen discharge limits, their impact on housing development, public health, and the environment, and also to include a balance of the costs of housing development and public health and the environment. The working group must include certain members, including the Department of Public Health and DEEP and housing, or designees, and a number of subject matter experts, and report to the DPH commissioner and public health, environment, and housing committees. Some of you may recall that in 2023 legislation moved from DEEP to DPH, the regulatory authority for these small community storage systems and also the small commercial subsurface sewage disposal systems. So the capacity change went up to 10,000. And in that law, there was put a deadline of July 1st, 2025 to put those new DPH regulations into effect. This bill would push that date back to July 1st, 2026 and require that the working group recommendations be considered before doing so. So to the S language, because this was added and because we had this change on the agenda, just to be clear, what this does is this adds the provisions on the DPH regulations for small community storage systems and household and small commercial subsurface sewage disposal systems. So it adds section 2 of the bill. And it adds representatives of those certain stakeholder groups to the working group. So the original bill didn't have the specificity there. And it also requires that working group to report to the Department of Public Health. Is there a discussion on the item? Oh, I'm so sorry. I forgot the motion. I thought I had a motion from, I did. I had a motion from Representative Kit and a second from Rep. Biggins. So thank you, but I always appreciate the reminder. Senator Anwar.
Madam Chair, can I ask a clarifying question? Is this bill going to JFS to the floor, or will it go JFS to Planning and Development?
Madam Chair, may I answer?
Oh my, this is a JFS to the floor. Thank you, Mr. Co-Chair. I believe Representative Clara DeStitrio. Please.
Thank you, Madam Chair. In the substitute language, it adds in subsection E, an association representing professional engineers and social scientists in the state. Can you explain to me what a social scientist does and why they're added in this bill?
Thank you very much. And if you can just give me a moment to get to the line number. Can you help me with that, Representative Clara DeStitrio? Okay. Representative, I may be mistaken, but I believe that may means may supposed to read as soil scientist is possible. I am not certain of that, but that is my assumption. I think but I can't say this with certainty, but that's the thrust of the bill is to look at soil as opposed to social issues. So I believe I would not be opposed to an amendment, and we certainly can clarify that with the proponents of the bill. I believe this bill, there was some conversation just yesterday, obviously with the change in S language. There may be additional changes going forward, but I'm certainly open to, if we'd like to make that change, we can do so if you'd like.
Madam Chair, I'd like to make a motion to amend the end of line 17, starting with social and changing it to soil.
Second. And who was that second? That was Rep. Carpino. So we have an amendment before us from Representative Clara DeStitrio, and this is seconded by Representative Carpino in line 17 of the JFS to change social to soil. Just give me 1 second. Okay.
Madam Chair, I'd like it to be taken by roll.
We can do it by roll call, not a problem. So this amendment has been made and seconded. Is there discussion on the amendment before us? Okay, seeing none, Madam Administrator, would you kindly call the soil amendment?
Senator Anwar,
Senator Anwar votes yes on the amendment.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton, Senator Marks, Senator McCory, Senator Summers, Representative Clara DeStitrio,
Yes, sorry.
Representative Berger Givallo,
Yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Dauphiné votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist, Senator Gordon,
Yes.
Senator Harkadel, Representative Cavers DeGraw,
Cavers DeGraw, yes.
Representative Kitt,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez,
Yes.
Representative Moran Bello,
Yes.
Representative Parker, Representative Paleto,
Yes.
Senator Rahman.
Senator Rahman, yes.
I did not see you on screen, sir, please.
You see me now?
Yes, sir.
Senator
Thank
Rahman
you.
votes yes.
Thank you. Representative Reddington Hughes,
Yes.
Representative Ryan,
Yes.
Representative Ryan, I did not see you on screen, sir.
I said yes.
Thank you. Senator Slapp,
Senator Slab votes yes.
Representative Steinberg,
Representative Steinberg says yes.
one more time for me, please, Representative Steinberg.
Representative Steinberg votes yes.
Thank you, sir. Representative Zupkis,
Yes.
Representative Belton, Senator Marks, Senator McCory, Senator Summers, Representative Elliott, Representative Gilchrist, Senator Harkadel, Senator Kushner, Representative Parker. Madam Chair,
Madam Administrator.
total voting 23, those voting yea, 23.
Thank you very much. The soil amendment has passed. Thank you. Further discussion on the bill before us, Senator Gordon.
Thank you, Madam Chair. I appreciate that. I do want to clarify one point. This JFS was emailed, it looks like, to the general membership of our committee at 8:47 a.m. So some of us are trying to sort through the details of it based upon less than 5 hours notice. But I do have some questions relative to Section 2.
That's
That-
fine, and I thank you. I stand corrected, but yes, appreciate the fact that our LCO team got to work on that with some late notice. So we're grateful for them. Please proceed.
And I'm grateful to the LCO as well, but nevertheless, trying to sort through this in whatever time we've been given. I'm looking through Section 2 and have a number of questions about it. I'll just preface my remarks. It's unclear to me why we even need Section 2, but there's some things that I'm going to ask for clarification based upon what I've been able to read through. It's my understanding that there's going to be a working group looking at Section 1 that's going to include, but not necessarily limited to, having someone from a residential construction trade association, someone representing municipal planners, another one representing municipal directors of health, another association representing septic system installers, someone representing professional engineers, and now we've changed social scientists to soil scientists. I'm just a little confused, and we don't know how many more people might be on this working group because Section 1 says including but not limited to, so we could go endless perhaps on this working group. I'm confused as to, it looks like this is being added in on the revised or this JFS. I'm a little confused. What is the reason why we would want to have consultation with a working group that has a minimum of 1, 2, 3, 4, 5, 6 members, but could be even more, given that it could potentially go out to infinity when it says, but not limited to. What is the reasoning behind having to consult this working group if we're dealing with sewage disposal systems, such as septic systems? I'm confused why we need an additional layer of bureaucracy in dealing with what really is a purview of the public health department, who there are people who understand very well about sewage disposal systems such as sanitarians. And I've worked with many, many of them over the years. So I just asked that question, Madam Chair, about since this is now a JFS.
Thank you very much. The S language was, came at the request of some of our members. This is a bill that was proposed by the majority leader. The hope was to be a little bit more specific about who some of the voices that were desired to be at the table, because as I said at the beginning, some of the hope is to have a discussion about these regulations and the balance and the impact on how housing development would go forward, but also assuring that we have our proper public health in place.
Thank you, Madam Chair. My next question is there an actual problem with the way for decades public health has issued permits that now we feel this JFS is going to try to solve a problem?
Well, actually, right now, the department is developing has developed new regulations to address the larger systems. So this is in the process of being developed and in conversation. Part of the hope of this bill is that that conversation would pause and then be completed by July 1st, 2026, as opposed to July 1st, 2025, so that more of the perspectives might more robustly weigh in, and then the same regs review process would proceed in the usual way through the department submitting the regulations and going through our regs review process.
Thank you, Madam Chair. And when you mention larger systems, what does that mean, larger systems? Is there a certain size above which large is defined? I'm just trying to understand more about where this is coming from and what this is going to tag, since this is now a JFS before us.
So in 2023, in PA 23207, we moved the regulatory authority from DEEP to DPH for those small community systems. My understanding, if I am remembering correctly, is it previously the limit at which DPH was regulating systems was 5,000 gallons. This new language has DPH regulating systems up to 10,000 gallons. And so that was where, and also in that statute was required that those regulations be changed by a certain date, something that we don't always do actually in statute. So this process really would push that date back and just allow for further conversation based on some of the input that we've heard from various parties. I will say, not that I have heard directly, but that I believe the majority leader and other members of this, the leadership on this committee have heard.
Thank you, Madam Chair. And it's one thing to say we'll go up to 10,000, but something that's small in the wording in here is actually talks about household. So that means then for household, unless you're building a gigantic house that you need an unbelievably large septic system, but for the average household, then for permits, there has to be consultation with the working group. Is that correct? After whatever date is listed in this JFS.
Senator, let me make sure I understand your question. Is your question, does a household then need to consult with the working group?
No,
Or
I'll clarify my question. If we're gonna, I'm not saying if, because not me, but if this were to pass and then we have to have consultation with a working group of, we have no idea what size it would be. It has to be a minimum size. We have no idea the maximum size. Does this mean then that if there's going to be a review for a permit to be able to issue a permit or approval for an average household, and it does say household in the JFS wording, that before that's done, there's going to have to be a consultation with the working group? The household doesn't have to ask, but the agency that's going to have to issue a permit then would have to consult with the working group. Is that the intent then of this JFS?
the intent of this JFS is that the working group input would be considered prior to the regs being passed and put through the process. That's the intent.
So that asks another series of questions, which is a bit confusing about trying to understand this JFS, especially how this is going to impact real world. So if there's a household that is seeking through a public health agency to get a standard size septic system, which is a sewage disposal system, and it does say in here about that the commissioner shall delegate to the commissioner of public health the authority to issue permits and approvals and to hold public hearings, but only after consultation with the working group and consideration of the recommendations provided by such working group. I'm just trying to understand this, that does this mean that in order to make a decision to issue an approval or issue a permit for a household septic system, the public health agency or authority has to seek the consultation of the working group and take into account or consider their recommendations, not for the regulations of the actual decision-making for issuing a permit or approval? I'm trying to understand the wording of the JFS.
No, that is not my understanding. Again, the idea behind this bill and the intent of this bill is that prior to the issuance of new regulations and the updated regulations that were required in PA 23207, the department would need to consider the input of that working group. I will say, I did actually just reach out via text right now to our liaison from DPH to ask if policies and procedures were in place, because as often happens, when we're in the interim, as things are moving, we have policies and procedures, but not regulations. We don't yet have policies and procedures. They have asked for that in one of the other bills that we passed out of this committee that would allow that to happen in the interim.
Thank you. So just so I can understand it then, so the legislative intent is very clear not to have this working group involved in decision-making that is actually done in the real world. And sometimes there's delays getting this done for issuing permits and approvals. It's actually more the regulations that then are used. Is that correct, Madam Chair?
That is correct. The intent is for this to inform the regulation, adoption, review, and approval process.
Thank you, because I'm just trying to make certain I understand how the mechanics will be, of this. I do have concerns why we need a working group. Is it the current status that the commissioner of, looks like here, this working group has a number of people, but is the current status that other people cannot now be consulted in the development of regulations by the agency? But that we have to have an actual working group to do it? Is there some legislative block that we're trying to fix here, Madam Chair?
No, of course, when the regulations go through the review process, there is a public comment period. I think that I'm having flashbacks to my years as P&D chair, and I'm looking at our P&D leaders here, who are also public health committee members, as you are, Senator. What was happening years ago, and this is going back, so, don't quote me word for word on this, but what was happening years ago is there were debates about the way the process was for those who are attempting to build and develop, going through DEEP versus DPH. And over time, there was this compromise reached, as I mentioned, to move some of this over to DPH. And I think in part for some folks, and again, not speaking for all, there was an effort to, and a hope to streamline that permitting process, because as we know, we don't talk about this here a lot, but we definitely have a housing crisis. You talk about this a lot in planning and development, and always with an effort to balance the environmental and public health concerns that we must keep track of and we must pay attention to and to value, with the need to provide for housing and housing development. So certainly there is input for the public in the regulations review process. This would just explicitly and specifically give the opportunity for a group that's been talking about those housing needs to bring together, of course, it won't be an enormous group of people, but those specific folks who are added in that S language to be included in the conversation, and perhaps others to provide that explicit opportunity for conversation on that issue specific to the balance of those needs, which would then be able to inform the regulation process.
Thank you, Madam Chair. Appreciate the information and clarification as I've been trying to take the time to read through the JFS language in the amount of time that we've had. I don't see we need Section 2, quite frankly. I don't see what it's trying to solve. Already a commissioner or an agency can seek whatever input it wants to seek. I don't see why we need to be adding some additional stuff into that type of decision-making, adding more red tape and bureaucracy into things. So, Madam Chair, I would want to make a motion or present an amendment to delete the entirety of Section 2 that is contained in the JFS.
So there is an amendment to delete Section 2. Is there a second to that amendment? Seconded by Representative Clara DeCitria. Discussion on the amendment.
Thank you. I don't think I need to discuss anything more about the amendment, given what I've already said, other than I do ask that when there's a vote, there be a roll call vote.
Thank you, Senator Gordon. Is there further discussion on the amendment before us? I will just speak to this. I think this bill has come to us at the request of the majority leader to be able to have more conversation. My understanding is that these regulations are, in process and by statute required to be adopted by the 1st of July. What this section does is to provide more time for that conversation and more ability to give input. And it is an amendment that I would ask my colleagues to vote against. Is there further discussion? Seeing and hearing no further discussion, Madam Administrator, would you kindly call the roll on the amendment to strike Section 2 of the bill?
Senator Anwar,
Senator Anwar votes no on the amendment.
Representative McCarthy Vehy,
McCarthy Vehy votes no.
Representative Belton, Senator Marks, Senator McCory, Senator Summers, Representative Clara DeCitria,
Yes.
Representative Burger Givallo,
Burger Givallo, no.
Representative Biggins,
Biggins votes no.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Dauphiné votes yes.
Representative D'Amico,
D'Amico votes no.
Representative Elliott, Representative Django, Representative Gilchrist, Senator Gordon,
Yes.
Senator Hockedal, Representative Cavers DeGraw,
Cavers DeGraw, no.
Representative Kitt,
Representative Kitt votes no.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez,
No.
Representative Morin Bello,
No.
Representative Parker, Representative Paletto,
Yes.
Senator Rahman,
Senator Rahman votes no.
Representative Reddington Hughes,
Yes.
Representative Ryan,
Votes no.
Senator Slapp,
Senator Slapp votes no.
Representative Steinberg,
Representative Steinberg votes no.
Representative Zupkis,
Yes.
Representative Belton, Senator Marks, Senator McCory, Senator Summers, Representative Elliott, Representative Django, Representative Gilchrist, Senator Hockedal, Senator Kushner, Representative Parker, Madam Chair,
Madam Administrator.
total voting 22, those voting yea 9, those voting nay 13, absent and not voting 10.
Thank you, Madam Administrator. The amendment fails. Is there further discussion on the item before us? Seeing and hearing none, Madam Administrator, would you kindly call the roll on the bill?
Senator Anwar,
Senator Anwar votes yes on the bill.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton, Senator Marks, Senator McCory, Senator Summers, Representative Clarice DeChier,
No.
Representative Burgess Javallo,
Yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
No.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Jengo, Representative Gilchrist, Senator Gordon,
Senator Gordon votes no.
Senator Huckadell, Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez,
Yes.
Representative Martinez.
Yes.
Thank you. Representative Morin Bello,
Yes.
Representative Parker, Representative Paletta,
No.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number four. Oh my gosh. Woof. Soil, fill. I just have lots of environmental things on my mind here. All right, House Bill number 7248. This is item number 4 on the agenda, and it's an act concerning well water quality. This is a JF to the floor. Is there a motion? Moved by Biggins, Rep. Biggins, seconded by Representative Cavros DeGraw. So the fill item, we have the soil amendment and the fill item. This bill on well water quality would actually allow the DPH commissioner to implement those policies and procedures that we were just talking about with laws related to cross connection between water supplies while in the process of adopting regulations. This actually came to us from what I call very technically the water folks at their request, and that those policies and procedures would be utilized until final regulations could be adopted. The bill also, well water testing. This is an issue that we've heard from many of our colleagues. When an environmental lab conducts a quality water test, either on a private or a semi-public well, they have to report those results to DPH and to the local health authority. So the issues around confidentiality have been tricky ones. We've had some recent changes in the law, and what this bill, it adds a new exception specifying that the Department of Public Health and the local health authority, as long as they have the commissioner's approval, they may disclose the test results or that information to DEEP. The existing law already does allow disclosures to a number of different groups. There is no S language as this is a JF, and is there discussion on the bill? Senator Gordon.
Thank you, Madam Chair. I know lots of bills are works in progress, and I understand that. But I think we have a moment here actually not to do a work in progress, but to actually do work and try to make this bill better. We've heard from local health departments the problems that are being faced, that their hands have been tied to some degree, which is unfortunate when we talk about public health relative to well water. And we certainly have situations where we have various types of contaminants that show up in well water. I'm not talking about the things people usually think about, such as radon, but other contaminants that pop up. We've heard about PFAS. We certainly know in some communities about salt, which can be a major devastating contaminant that really whacks the potability of water and the safety of water. And we've heard from our local health departments prior, in fact, during public hearing, about that prior changes in the law have hurt their ability on the ground to do some of what they're charged to do, which I would hope we agree with, which is uphold and promote public health. And certainly having safe and clean water is a major part of public health. And I think we should take this as a moment to improve this bill and to actually make certain that those who are doing the very difficult work through local health departments be able to get them back to be able to do what they need to do to help people and to give information to people, especially when we're talking that there are many households out there where we have children that unsafe water that someone may not know about can have detrimental effects lifelong regarding health. With that in mind, I will propose an amendment, Madam Chair. And I'm happy to, and that amendment is, unless you want me to state what the amendment is?
Yes, please.
Sure, happy to. And that amendment would be looking at, and I just want to make certain I got these line numbers correctly here, is that when there's a reference in lines 21 to 22 about quote, or the local health authority, end quote, there's a line in 23, quote, or local health authority, end quote. There's a line 24 to 25, quote, or local health authority, end quote. I just want to make certain I'm getting this correctly here. And then in line 33, quote, local health authority or, end quote, to have those deleted. And then in line 35, create a new sentence that reads, quote, any results submitted to the local health authority shall be deemed public records and subject to disclosure under section 1-210, end quotes.
Thank you, Senator Gordon. I may need you to actually repeat the line numbers in the bill for those
Pass them around.
deletion. I have a copy, but the line numbers
good.
do not correspond. So
Right, and that's why.
so if I may, I wasn't able to keep up with you. So if you could just repeat the line numbers for me,
Sure.
that would be wonderful.
And that's why I'm trying to double check as well that the line numbers match on the, or I'm saying the right line numbers on the raised bill. So, when I'm looking at section 2, what it's designed to do is strike section 2 and basically replace it. And let me clarify that. So it's designed to strike section 2 and provide substitute with the following, which is in what I believe we have copies that are out.
Yes, so
Yes.
I think that if you are able to repeat the lines, we then will not need to provide the copies to
Yep,
all of
and
the
I'm happy to
members. And
do
I
that.
think then we can have, if you just give me 1 second,
I'm happy to do that again if you want for the right line numbers.
that would be wonderful, Senator. Thank you for repeating those.
Yeah, no problem. Happy to
So
do
we
that. I just want to
probably
make
have
certain,
the amendment before us.
and I
Go
just
ahead.
want to make certain I got the right line numbers that I'm reading.
Gotcha. Take your time.
So my understanding is the line numbers would be in section 2 would be starting with it would be lines 21 and 22. The words or the local health authority would be deleted.
Mhm.
The next one would be line 23. the words "or local health authority" would be deleted. The next would be line 24 to 25, the words "or local health authority" would be deleted. It would be it would be line 33. The words "local health authority or" would be deleted. And lines, just want to make certain I got the right word here, the right line here.
I believe it's also
Yep,
lines
and
26 to
yep,
27.
in lines 26 and 27, it would be words "the local health authority" and would be deleted. And then starting on line 35, a new sentence would be created. And that would read, "Any results submitted to the local health authority shall be deemed public records and subject to disclosure under section 1-210, period."
Thank you. There is an amendment properly before us. Is there a second to the amendment? Seconded by Representative Zupkis. Is there discussion on the amendment? I'll go to you first, Senator Gordon.
Thank you, Madam Chair. Just to recap, I believe really the intent of this is to make certain that we can give back the very important tool in the toolbox that local health authorities had used for years and years and years before a law change, and really allow them to deal with on-the-ground issues when we're dealing with well water issues. For example, when we have salt contamination in some towns, such as Tolland, which is a big issue, people may not know about it necessarily or have not known about it, and it's not something you just go and would routinely test for. But health authorities do know of these things, and to be able to have them to help other people who may not know about potential water contamination, let alone then know to even go and try to test for it, that is missing a huge opportunity for local health authorities, as opposed to having to go now and try to get permission from, say, DPH to do that. Why are we tying their hands when really local health authorities are the ones on the ground doing that type of stuff? We've heard testimony from them. And so for me, this is one of those common sense types things that we could do to further the good work that's done every day by our local health departments and authorities. And that is the intent of this amendment and what the goal of the amendment is. Thank you, Madam Chair.
Thank you, Senator Gordon. Senator Elmore.
Thank you so much, Madam Chair. I wanted to clarify a few things from the proponent of the amendment. If Senator Gordon, would you be prepared? So Senator Gordon, I wanted to understand, you are trying to eliminate the role of the local health department through this amendment?
I'm not looking to eliminate the role. What I'm looking to do is to eliminate basically the local health departments having to go through a process of needing to deal with the DPH to get permission and or approval to be able to do certain things that prior they had been doing for years and years and years.
Thank you for clarifying that. The part about this is that if there are contaminants in a specific area, it is important to have a broader picture available so that we can start to see trends so the local health department may not necessarily have the bigger picture in front of them. And DPH would have that ability to look at trends and areas where, let's say, the sodium chloride is much more, and then have the opportunity to address that. Would your amendment take away from that opportunity for DPH?
Thank you for that very good question. No, we're not at all. And in fact, as we know, collecting data from many things is extremely important. And we shouldn't be limiting appropriate data collection. This doesn't at all preclude or obviate the role of DPH, but not always would DPH be there on the ground as a local health department would, going perhaps into neighborhoods or specific homes to deal with various issues in a particular town. So DPH would certainly be involved. I don't see it limits their role whatsoever. Local health authorities liaison and work with state DPH all the time, and sometimes even with federal agencies. So I don't see this at all limiting DPH. In fact, I would like to encourage at times DPH to continue its work that it does with the local health authorities. This doesn't at all limit DPH in any manner, and in fact, it won't limit at all an understanding of a bigger picture. And in fact, I would say that there are times that DPH can better understand the bigger picture by its continued work with the local health departments. But while that is going on, you still have the granular issue of having to deal with things in particular specific areas of our state where the local health authorities certainly are there on the ground.
Thank you for clarifying that. And Senator Gordon, I wanted to also clarify. It's come to light in the last 24 hours that there's a significant negative impact on the budget for the Department of Public Health, which is going to trickle down, not trickle down, but have a significant impact on the local health departments. Is this like a preemptive way in recognizing that the local health departments will be devastated to try and shift some of the work?
Thank you for that question, Mr. Chairman. No, this is actually responding to what has been tried to be done before anything has or has not happened from the federal government. And in fact, direct testimony this committee heard from local health departments and their state, I guess, professional society or organization that we have heard. So this is directed at what is going on here in the state of Connecticut, the work that the local health departments are doing and trying to do. And again, their testimony came in prior to anything that may have been heard from the federal government.
Thank you for clarifying that as well. And Senator Gordon, one of the other part in the amendment line number 21 through 23, similar bills were proposed in the past on this aspect, and the realtors were very concerned because that would have a very significant negative impact on the real estate value in the entire region if this was a language like this would move forward. So there would be significant negative impact to the entire neighborhood and communities, and also the residents residing in that area if this amendment was to pass. Have you had an opportunity to run this by the realtors or others as well, since they've been so strongly opposed to this? And of course, the well-being of the individuals directly impacted is covered through the DPH and the local health department, so they will have that information. Only the buyers would have the information, and the ones who are planning to buy would have that information in a timely fashion. But have that publicly displayed everywhere would have a negative impact on the entire neighborhoods in the communities, including some of the areas that we may be representing.
And in your lengthy statement, Mr. Chairman, what was the question?
Have you had the opportunity to look at the realtor's perspective on this? They've been opposed to this language in the past when some languages like this were proposed.
Well, thank you for your question. And I also do appreciate your comment about the impact on some of the communities, such as Tolland, for example, that has been very hard hit by an issue with salt. No, I have not spoken directly with the realtors, but I will note that this is the Public Health Committee, and we've heard very strong testimony from those who are doing the work through the local public health agencies and authorities in support of the work that they are doing.
Thank you for clarifying that. Thank you, Madam Chair. Back to you.
Thank you, Senator Anwar. Representative Claridis Dietrich.
Thank you, Madam Chair. And to the proponent, one of the proponents of the bill, besides myself. My question is, if I'm buying a new home and the people that are buying my home want me to do a water quality test, and that water quality test shows high levels of anything, copper, radon, arsenic, whatever's in there, that will give me, as the buyer, pause to see if I want to have, either I don't want to buy the house or they're going to going to take money out the house or put in a mitigation system. But the issue is, if these levels are very high, that takes care of buyer seller. But now what if I'm Mrs. Jones that lives next door to said house, and I don't know that I need to get my water tested because my neighbor just came back with extremely high levels of you name the mineral or in the water. So where does that leave me? Through you, Mr. Chair, to the proponent of the bill.
Senator Gordon.
Thank you, Madam Chair. Well, that leaves you in a situation where your health could be in jeopardy. Because then that's not information then that would then be known or be able to be dealt with fully by the local health authority. And yes, that can pose a problem. For example, salt. Salt's one of the most hydrophilic, water-loving substances that we have. And it will bloom vertical and horizontally over time, very much so. And we do see that. Various communities do see that, just not Tolland. And that can affect other people. And very much so when you're talking about, especially communities that run on wells, where that is their water supply. They have no municipal water supply that can then try to abate or mitigate that. So yes, that could leave that person who otherwise would not know and then may make the decision to test and then have to deal with mitigation, especially not wanting to even drink the water if the water has say too much sodium in it, kind of high and dry, so to speak.
Representative Claire Teacher.
Thank you, Mr. Chair. I appreciate that answer. And with that, I encourage my fellow members of this committee to support this amendment because I think it truly is a public health concern and issue. And that's why we're here, to protect the people of the state of Connecticut. Thank you, Mr. Chair.
Thank you very much. I will add my input to this discussion. I have met with quite a few local public health directors in discussion on this issue. What I have not been able to do is to circle back to the Department of Public Health to talk about how this may work in a more efficient way or more effectively for our local health departments. And also to the point of being able to the good ranking member's point of being able to understand what the safety issues are, because as we know, air and water, they don't really care about jurisdictional boundaries of any kind, whether it's properties, designations, towns, cities, states, national boundaries. Air and water, they go where they're going to go. So I am very committed and have been in contact with the department to work through this issue and discuss how we might do this. I would ask members to vote no on this amendment because works in progress mean that we will continue to have the conversation. It means that we need to have some thoughtful input around this because there have been a number of stakeholders who have expressed different opinions. And what we seek to do when possible is to come up with a compromise that works well for everyone. But the bottom line for all of us is the health and safety of our residents. And clearly, water is the source of life. And we will need to make sure that we're protecting our residents. But in this particular instance, because we would like to do this in a way that gives us the time to have those thoughtful conversations, work together with the stakeholders, and sit down together with our local health directors and the department in conversation, I would ask that we hold off on this amendment, but know that these conversations are going to be continuing on this bill, so you very well may see changes on this in the future. Is there further discussion on the amendment? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes no on the amendment.
Representative McCarthy Vehy,
McCarthy Vehy votes no.
Representative Belton,
Belton votes no.
Senator Marks.
Marks votes no.
I did not see you on screen, Senator. Try again, please.
Senator Marks votes no.
Thank you. Senator McCrory, Senator Summers, Representative Claire Teacher,
Yes.
Representative Burger Givalo,
No.
Representative Biggins,
Biggins votes no.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Dauphiné votes yes.
Representative D'Amico,
D'Amico votes no.
Representative Elliott, Representative Django,
No.
Representative Gilchrist,
Representative Gilchrist votes no.
Senator Gordon,
Senator Gordon votes an emphatic yes.
Senator Harkadel, Representative Cavus DeGraw,
Gavros DeGraw votes yes. No. Sorry. It's that time.
Representative Kidd,
Representative Kidd votes no.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez,
No.
Representative Morin Bello,
No.
Representative Parker,
No.
Representative Paletto,
Yes.
Senator Rahman.
No.
I did not see you on screen, sir.
I'm here.
You're in the room? Thank you. Representative Reddington Hughes,
Yes.
Representative Ryan,
Votes no.
Representative Ryan, I did not see you on screen, sir.
Well,
Thank you.
I can see myself.
Senator Slapp,
Senator Slapp votes no.
Representative Steinberg.
Representative Steinberg votes no.
Sir, I did not see you on screen.
Representative Steinberg votes no.
Thank you, sir. Representative Zupkis,
Yes.
Senator McCory, Senator Summers, Representative Elliott, Senator Harkadel, Senator Kushner, Madam Chair,
Madam Administrator,
total voting 27, those voting yea 9, those voting nay 18, absent and not voting 5.
thank you. The amendment fails. Is there further discussion on the bill before us? Senator Gordon.
Thank you, Madam Chair. Is this a time for me to bring up my 20 other amendments?
Go right ahead.
Just kidding. I'm certainly not surprised, but certain disappointed. I think this was a good opportunity for us to do something as opposed to another work in progress. But I just want to say then, I do still have concerns. If this is going to be added to our big list of work in progress, then we can certainly see what we can do for a work in progress. But I'm not going to support the bill itself that is before us. Thank you.
Thank you, Senator Gordon. Is there further discussion on the item before us? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes on the bill.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator McCory, Senator Summers, Representative Clarice Detrier,
No.
Representative Burger Givallo,
Yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
No.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative D'Amico,
Miko votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Senator Harkadel, Representative Cavus DeGraw,
Everest DeGraw votes yes.
Representative Kitt,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez,
Yes.
Representative Maureen Bello,
Yes.
Representative Parker,
Yes.
Representative Paletto,
No.
Senator Rahman,
Yes. Sorry.
Representative Reddington Hughes,
No.
Representative Ryan,
Votes yes.
Senator Slabb,
Senator Slav votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
No.
Senator Marks,
Senator Marks votes yes.
Senator McCrory, Senator Summers, Representative Elliott,
Elliott, yes.
Senator Harkadel, Senator Kushner. Thank you, Madam Chair.
Thank you very much, Madam Administrator. Before we move on to the last item on our agenda, I meant to note this at the beginning. This year, we had almost 300 proposed bills and concepts that were screened before this committee. That's up from 2 years ago, it was about 210. So I know that this is the last bill before us. We have seen and heard quite a few items. We know they don't all make it through, but with that, I will call item number 5 on our agenda. House Bill number 7249. This is an act concerning assisted living services agencies and rehabilitation facilities. This is a JFS to the floor, LCO 6935. May I have a motion?
So moved.
Moved by Senator Anwar and seconded by Representative Clarice Detrier. This bill will require our assisted living services agencies, supervisors of assisted living services to ensure that client service programs for residents of managed residential communities who receive services include protocols for providing emergency medical services. The protocols may include the types of emergency medical services may be provided, including treatments for asthma, COPD, dehydration, dizziness, or confusion. Those protocols may include first aid treatments after a fall and treatments for hypoglycemia, as well as the categories of staff who may provide these services and the circumstances under which the staff may provide residents these services, including using the 911 system. This also requires that the supervisors ensure the staffs are educated, and it does not include state-funded congregate housing facilities. The JFS language removes the provisions requiring the rehabilitation facility administrators to ensure that patient care plans include individualized mobility plans. This was section 2 of the original bill. It requires protocols to also include the circumstances under which the staff should seek EMS, in other words, call 911. And finally, it replaces, actually not finally, one more after that, it replaces the ALSA administrators with supervisors, and it removes the requirements that collaborate with the MRCs when creating those protocols. And is there discussion on the bill before us? Seeing and hearing, well, let me say one thing. This bill is likely to change again. We've heard just last night, actually, additional feedback that we were not able to take into account into this bill. So you're likely to see changes when this bill comes up to the floor. Madam Administrator Beverly Henry, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes on the bill.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory, Senator Summers, Representative Clarice Detrier,
Yes.
Representative Berger Givallo,
Yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott.
Elliot, yes.
I did not see you on screen, sir. Please.
Elliot, yes.
Thank you. Representative Jengo,
You hear me?
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Yes on the wording before us at this time.
Senator Harkadel, Representative Cavers DeGraw,
Gavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Martinez,
Martinez votes yes.
Representative Morin Bello,
Yes.
Representative Parker,
Yes.
Representative Paletto,
Yes.
Senator Rahman,
Senator Rahman, yes.
Representative Reddington Hughes,
Yes to what was presented today.
Representative Ryan,
Yes.
Representative Ryan,
Yes.
thank you. Senator Slabb,
Senator Slav votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
Yes.
Senator McCory, Senator Summers, Senator Harkadel, Senator Kushner. Thank you, Madam Chair.
Madam Administrator, thank you very much. The votes will be held open and we'll leave them open until 4:30 today. With gratitude to all of you and wishing you a wonderful weekend, hopefully some rest. We will be in recess until 4:30. Thank you, everyone.
Hi, Bev. Are you there?
Hello. You,
Oh, hey, Peter. Can I put my votes in?
yeah, let me make sure. All right. So the
Okay.
first item, SB 1508, was a roll call. How do you like to vote?
Yes.
Our next item was SB 1538, an act concerning emergency department boarding crowding. How do you like to vote?
Yes.
Our next item was HB 7247. How do you like to vote?
Yes.
An amendment. 5 for that. Okay, you're all good, Representative.
All right. Thank you.
All right, and I'll take
Bye.
Representative Gilchrist next. Bye. Have a good one.
Have a good weekend. Awesome. Thank you.
Okay. Representative Gilchrist, I'm missing for SB 1508. How do you like to vote?
Yes.
I'm missing you for SB 1538. How do you like to vote?
Yes.
I'm missing you for HB 7247. How do you like to vote?
Yes.
An amendment. I have you for that one. All right, you're all good. I have you.
Thank you. Have a good one.
Yeah, you too. Representative Elliott, you're up next.
Ready for you.
Okay. The first item I'm missing you for is SB 1508. How do you like to vote?
Yes.
Our next item was SB 1538. How do you like to vote?
Yes.
Our next item was HB 7247. How do you like to vote?
Yes.
Our amendment. Our next item was HB 72. Oh no, I have you for that one. And I have you for this one. Okay, you're all set, Representative.
Thank you so much. Take care.
And then I see Senator Marks and Senator Hockendahl. If you guys are here, I'm gonna take you guys. All right.
Senator Hockendahl, I can't vote right now because I'm driving. As soon as I get over, I will and vote.
All right. Thank you. Thank you. Senator Marks, are you
Yeah.
able to?
No, I'll be parked in about 2 minutes and then
Okay.
I'll get on.
All right. Just raise your hands. I'll look out for you guys, okay?
Yep.
All right. Bye. Okay, Senator Marks, are you ready?
I am ready.
Okay. Oh, you need to make sure I see you first.
You see
Okay.
me?
Yeah, I see you now. Okay, good. The first item I'm missing you for is SB 1508. How do you like to vote?
Yes.
The next item I'm missing you on is SB 1538. How do you like to vote?
Yes.
The next item I'm missing you on is HB 7247. How do you like to vote?
Yes.
The next item I'm missing, oh, that's an amendment. That's an amendment. I have you for this one. Okay, I have you for everything. You're all set.
Thanks.
Yeah,
Have a good weekend. Thanks for all you do, Peter.
Thank you. Have a good one. Hey, Senator Summers. Let me see.
Hi, how are you?
I'm good. Let me see which ones I'm missing you on. All right.
Okay.
I have you for this one. I'm missing you for SB 1538, an act concerning emergency department boarding and crowding. How do you like to vote?
Yes.
Yes, okay. I'm missing you for HB 7247, an act concerning sewage disposal requirements and their impact on housing, development, public health, and the environment.
Yes. Yes. Do you know how did that vote go? Did that pass?
Yeah, it did pass.
Okay, great, thanks.
Are you talking about the bill or the amendment?
It's the bill as amended, right?
Yeah, the bill as amended.
Yes. That
Okay.
passed?
Yeah,
Okay,
that passed.
I don't, okay. The amendment failed, right?
The second amendment failed, but the first amendment passed.
What was the first amendment? I'm sorry. I'm sorry I'm asking you all this. I've
No,
been like in 14
it's
different
okay.
meetings
Yeah.
today.
So it changed. There was a mentioning of social scientist, and they changed it from social scientist to soil scientist. That's the amendment.
It was supposed to be soil. I think that
Yeah.
was a typo.
Yeah, so
it was
they
the soil
amended
in
it,
the
yeah.
first one. Yeah. Okay,
Yeah.
great. Perfect.
Okay. And so, would you like to change your vote?
And the last one,
Or
wait a minute. I can't vote on the amendment anyway because I wasn't there. So
Yeah.
I'm
would you-
still good. Yes.
yeah, so you're still good.
As
Okay.
amended, I still want it. Yes.
Okay. And then I'm missing you for HB 7248, and not concerning well water quality. How do you like to vote?
I'm going to vote no on that one.
Okay. And then I'm missing you for HB 7249, and act concerning assisted living services, agencies, and rehabilitation facilities.
I'm going to vote yes on that.
Okay. And let me just double check, make sure I have you for everything.
And I thought that meeting was going to be quick today.
Me too.
Not as long as the other night, but
Exactly. All right, you're all set, so you're all good.
all right. Thank you. Have a good weekend. Bye-bye.
You too. All right. Senator Hockedale, I see that you're ready.
Yes.
Okay. So I'm missing you for SB 1508, and act concerning medical records. How'd you like to vote?
Yes, please.
Thank you. The next item I'm missing you for is SB 1538 and that concerning emergency department boarding and crowding. How'd you like to vote?
Yes, please.
Okay. I'm missing you for HB 7247. How'd you like to vote?
Yes, please.
That's an amendment. That's an amendment. I'm missing you for HB 7248. How'd you like to vote?
Yes, please.
I'm missing you, and then I think I'm missing you for the last final one. HB 7249. How'd you like to vote?
Yes, please.
Okay. And you're all set. All right. Have a good one.
Have a good weekend.
Yeah, bye. Thank you. Well, Senator Kushner. Hi. Okay. Are you ready?
Yes.
Okay. I'm missing you for SB 1508. How would you like to vote?
Senator Kushner votes yes.
I'm missing you for SB 1538. How would you like to vote?
Senator Kushner votes yes.
I'm missing you for HB 7247. How would you like to vote?
Senator Kushner votes yes.
I'm missing you for HB 7249. How would you like to vote?
Kushner votes yes.
And I'm missing you for HB 7249. How would you like to vote?
Kushner votes yes.
And you're all set. All right. Have a good one.
Thank you.
That's what I did. Really now. Went to my computer career.
What's up,
big guy? How you doing?
I'm good. How are you?
Man, I'm black. I'm blessed. And I'm on the right side of the soil. How
I
about
hear
that? How
I hear
about
you,
that for an answer? Huh?
Exactly. All right, are you ready?
How many bills we got today?
We got 5.
Anyone controversial? Which one you think McCoy wouldn't like?
Oh, I wouldn't know, sir.
You know, you be watching them public hearings. What
All right,
you got? What's the first one?
Okay, I'll read them out to you. So SB 1508, an act concerning medical records. How'd you like to vote?
What? Yes, I'm okay with that.
Okay. The next bill is SB 1538, an act concerning emergency department boarding and crowding.
Yes.
The next bill I'm making you for is HB 7247, an act concerning sewage disposal requirements and their impact on housing development, public health, and the environment.
Yes.
HB 7248, an act concerning well water quality. How do you like to vote?
Yes.
And then our final one, HB 7249, an act concerning assisted living services, agencies, and rehabilitation facilities. How do you like to vote?
Yes.
Okay. Right.
All right.
And you're all set. All right.
All right,
Have a good
thank
one, man.
All right. Bye-bye.
You too.